joining us to discuss this topic is Dr. Sasha Oliver, resident in microbiology at the University Hospital of the West Indies, and Dr. Oliver is also the operator of the YouTube channel Dr. Microbial 876. Dr. Oliver, good evening.
Hey, good evening, Dr. Jackie. How are you?
I'm good. Dr. Sasha. Good. No, I'd love us to talk about antimicrobial resistance. But the first question is antibiotic resistance the same as antimicrobial resistance?
So, in order to answer that for you, I will have to actually define for our listeners what antibiotics are.
Wonderful.
So, antibiotics are actually medicines that are used to prevent and treat bacterial infections. So, with that said, antibiotic resistance and antimicrobial resistance are not the same thing. So, what I'm saying is that antibiotic resistance occurs when bacteria change in response to the use of the medicines, so the use of antibiotics. So in a sense, it's when the drug that is designed to kill them no longer works because the bacteria develop ways to defeat the drug.
Why the bacteria would want to do that?
Because everybody wants to live. Nobody wants to die. So it is actually the bacteria and not the humans who become antibiotic resistant. So these bacteria will actually or can actually infect humans and make it harder to treat them. So antimicrobial resistance now is a broader term that encompasses resistance to drugs. And these are the drugs that will treat other infections caused by other microbes such as parasites, example, those that cause malaria, or viruses, example, that which causes HIV or even fungi.
So the antimicrobial, when you talk about microbes, you're looking at the bigger picture, not just the bacteria, you're looking at all the little germs, as we will say in Jamaica, everything.
Yes, those germs that we can't see, right.
Why should I care about antimicrobial resistance? Why should any of us care?
Because antimicrobial resistance affects everybody. So not only in human medicine, but it can affect agriculture, it can affect veterinary science, because even the poultry that some of us eat, all these areas and all these animals, so the veterinary animals, those that are used in husbandry, they get infections from time to time and have to be treated with antibiotics.
Okay.
So if these animals that are treated with antibiotics are not able to be remedied by them, then of course we're going to have losses both economically and otherwise.
Are there any examples, I should say, of antibiotic resistance?
Sure. So for example, everybody knows what a boil is.
Yes.
So a boil tends to be caused by an organism or a bacteria known as Staphylococcus aureus. Right? It's a fancy name for one of the germs. So it's usually found on skin. And most times it is treated with a particular medication. Right? And over the years, through antibiotic overuse, these organisms become resistant to that medication. And of course, we know these things. My grandmother used to call it consumption, but it is known in the medical world as tuberculosis.
Yes.
It was treated with a certain regimen or a certain combination of drugs. And in places in the world, it is no longer being able to be treated with that combination of drugs. And this is due to antimicrobial resistance.
Interesting. So what first time people used to use to treat a infection that still exists, you can't use it anymore because these germs are resistant to the antibiotics that used to be used first time.
Yeah, because they were born that way, call it that. Right?
It's almost like bad people, right?
Something like that. And some of them actually mutate. So for our patients, and I'm not picking on anybody, but for some of our patients who, take the antibiotic and when you start to feel better, you throw it one side, these are some of the things that cause antibiotic resistance to happen.
So in other words, for those persons who get a particular course of antibiotics, let us say for a week, and after 2 days they start to feel better, they decide they're not going to take it for the week.
Mm-hmm.
That is what can lead to that.
Right. And then this now, suboptimal treatment would actually cause the bacteria to get a chance, then in layman terms, get a chance to develop resistance to the drug. And then when you start feeling sick again, because the bacteria may have mutated, starting to take the medicine that you got before, it will no longer work.
So in other words, the antibiotic would, let us say, treat some of the bacteria, and the rest would be there kind of lurking around.
Right.
And then the rest that were there lurking around, they develop this resistance.
Right. So the rest that are lurking around, would actually be, call it the stronger set, because the weaker ones would die off. So it's like you're selecting for a stronger, more hardy type of germ that this antibiotic cannot kill.
And so when this sort of scenario is set up in a number of different people, because I wouldn't think it's just one person, it would happen too. Because,
No.
So when it's happening time and time again.
Right.
That
happens.
That is how it. So how can we then reduce this antibiotic resistance?
Well, so the best way to really reduce antibiotic resistance is to use the antibiotics correctly, meaning that you take antibiotics only when they are prescribed by a licensed, qualified physician. Take antibiotics exactly as they are prescribed, so do not skip your doses. Complete the full course of your treatment, even if you're feeling better, listeners.
Yes.
Never take antibiotics that are prescribed for someone else. And do not take antibiotics for viral infection.
I've said this before. I'm sure I've said this on this program. I've had patients who cuss me, that they cuss me, why you not giving me no antibiotic, and you say me have a little flu. I said to them, but flu is a virus. And I mean, you don't have a bacterial infection. So you do not need an antibiotic. So,
And also, us physicians can actually assist by actually only prescribing when the antibiotics are needed. So I'm happy you said that, because sometimes, you might want to, a patient may come in and try to muscle some antibiotics out of you. You have to stand your ground, physicians. And also, using culture-directed therapy. So
that's a big term, man. That's a big term.
So what I mean by culture-directed therapy, for example, a patient may come with an infection, maybe a UTI.
Urinary tract infection, yeah.
Right. We get a urinary tract infection, and we give some antibiotics to treat them, to help to take the edge off initially. But before we start that treatment, we need to take a sample and get it properly cultured, meaning you bring it to the lab and test it to see what bacteria is in there and what can actually kill them. So we pinpoint, so it's like a silver bullet. So you pinpoint that target and you aim for that target, and this is what you're going to treat.
Yes, but some patients might say, boy, doc, I can't wait, And, there are different scenarios there, especially with the urinary tract infections and so on. But we get the point that, you really and truly should have some form of a test to direct the therapy.
Right.
Definitely. When you think about antibiotic resistance, because we're really focusing on antibiotic resistance, is there any test for it?
Okay, so I had mentioned before the culture-directed therapy,
yes.
Meaning that you test it in the lab. So, for example, if a patient has a wound, right, and this wound is taking long to heal, and you've been treating it with antibiotic and it's not working, what we'd ask is for a sample. So you swab the wound, you send it to the lab. In the lab, we put the sample in conditions that would cause the bacteria to grow.
Yes.
When it grows, then we identify what it is and what can kill it, what exactly is not going to work on it. So when it is resistant to a particular antibiotic, we can pinpoint in the lab which one is not going to work and which one will work. And based upon which one works or gives the indication that will work in the lab, then us as medical microbiologists would make the recommendation that this is what should be used while thinking about the other parameters like the patient's other comorbidities, the other illnesses
the
the
other
patient may
illnesses
have.
that the patient may have. Because,
Right.
one of the things I've noticed, and I'm sure other physicians will notice it, and you as a microbiologist would note, is that some infections that first time we used to be able to treat it with X antibiotic, no,
Right.
then you need a more potent antibiotics, and some of those are only available, let us say, in a hospital setting.
Right.
Yes, and have to be administered not orally but intravenously. So it means it's a different scenario we're looking at. Um, Dr. Sasha, we have about 30 seconds left. Any take-home message here? Any words of advice?
Sure. We have to remember to take our antibiotics as they are given. Ensure that if you have a patient who's having some suspected infection, you try not to touch the wound. If it is a wound, please, folks, avoid, I don't know if I can say this on the air, but avoid spitting on the road, cover your
Yes.
nose when you cough
Yeah,
or
that's true.
sneeze. And please ensure that you wash your hands properly with soap and water. If you cannot wash your hands, then you use hand sanitizer that has 60 to 80% of ethyl alcohol in it.
That's true. Sasha, we're out of time, but this has been a very interesting, absolutely interesting conversation. Thank you so very much for joining us this week.
You're most welcome. Bye-bye.
We just heard from Dr. Sasha Oliver, resident in microbiology at the University Hospital of the West Indies, about antimicrobial resistance.